Hey, this is Chris, keeping it real, facts over fear. How are you doing today? Just a kind of a run-of-the-mill comprehensive report today. Other than the fact that cases are going through the roof, a lot of other important parameters are not getting any worse, and so that's good. The indicators, excuse me, is that we're seeing a lot more cases, but we're not seeing a lot more hospitalizations, and we're not seeing a lot more deaths. And so those two statistics are really what's important. The number of cases is really secondary to those two other things. And so, just as a reminder, all data in the charts is a 14-day rolling average. One thing that has changed in the reporting this week is that the North Carolina Department of Health and Human Services is back to assigning deaths to the date on which they occurred. Up until last week, they had been reporting deaths on the date they were reported, and so it takes 2 or 3 days to do that. It takes a little while for the death certificate to get signed and sent in to the proper authorities, and then forwarded on to whoever's keeping track of all this at NCDHHS. And so basically, you have to look at something like this graph is valid through today, but these graphs are not. You remember, these graphs show the specimen date for when people went in to get tested, and of course there's about a 3 or 4 or 5 day lag time for that, and of course with the deaths we're seeing that too. So what we'll see is the deaths are going to level as those dates are backfilled with the information. That graph is going to level off, and it's going to be much closer to that 0.01 line, although it's still, I don't think it's going to reach it anytime in the next week or so. The overall death rate has dropped to 0.8%, which is good news. That is surprising, but it is very good news. And so we're getting a lot more cases, but we're not getting a lot more deaths. Cases are on the way up with no real sign of plateauing. I'll still expect it by the end of the week, but of course that should be under outlook, shouldn't it? But who knows? The analysis pretty much the same as next week. Thanksgiving has pretty much worked its way through the system, but we still have children in school. People continue to travel and socialize, and masks simply do not provide any meaningful protection. And so that's why we're seeing this runaway. Because what's changed? The main driver of this pandemic is and always has been the movement of people and the intermixing of people, and that's what does it. The only thing that had any statistical effect on this pandemic was the initial lockdown, where most people stayed home, and now most people are not staying home. And so, if masks really did work, we would not be seeing these numbers, but they don't work, and so we are seeing these numbers. The new herd immunity date is April 6, 2020. That's a week sooner than it was last week. Deaths remain low and steady at about 30 on a 14-day rolling average. A lot of that is due to the fact that, as I mentioned up above, North Carolina Department of Health and Human Services is assigning deaths to the death date and not the date of reporting. And so that has as I refigured the calculations, it pushed the current, it upped the previous rolling average slightly, but it has pushed the current one down, although that is still a week ago. So I expect the deaths per case to remain about the same, or maybe a couple percent higher. This was from last week. I don't know that we're going to get back to 1%, unless there's a huge segment of the population that is severely at risk, and the virus sweeps through them. But I don't think we have that kind of population left. So we are more than halfway to herd immunity. What's going to go on with the cases? I'm hoping that they will plateau this weekend. We'll see. You can look on the day to day. I did look at, just before I started making this video, I looked at the website, and cases were down to about 4,500 today. Unfortunately, that's still a couple hundred more than it was last Monday. And so Monday is usually a light reporting day, and that's pretty That's pretty heavy for a Monday, but we will see as we go through the rest of the week. And I'm going to look at the day to day. I think that's a fair thing to do, and we will see what happens. Mainly the uncertainty revolves around Christmas. It's only 11 days away. I think we're going to see the same thing we did at Thanksgiving, where people are going to go get tested to make sure that it's at least somewhat safe for them to drive and to visit their family members and whoever else they want to visit. So I think we're going to see another substantial rise in testing, and that may or may not lead to a substantial rise in positive tests. We'll just have to wait and see. But that effect is probably going to start. Let me see. This is the 14th, and so we've got 11 days to Christmas, and so at the beginning of next week we'll probably some people by the end of this week are going to start doing that, and with the idea that they can get tested, and if they are negative, then they can just kind of hunker down until they need to get going where they're going. What's going on in North Carolina with the number of hospitalized number of COVID-19 cases? Well, I explained that last week. They changed the reporting, and so that's that. And so it looks like the cases are on the rise, but they are not especially. Admissions to discharges, the ratio has leveled off now for about the last week and a half or 2 weeks. That dip was right around Thanksgiving, so just kind of ignore that. And so from here to there, that's about a week and a half, or maybe even 2 weeks. That's about a week and a half. It's really leveled off, and so that is good. So in other words, what this graph is showing is for the number of for the number of people going into the hospital, there's slightly fewer people coming out, but that ratio has plateaued, and hopefully we'll see that go down. And as I mentioned, unfortunately, some of these discharges are actually deaths, but fortunately, the death rate is rather low. Same thing as last week. Here's why it's going on. The outlook: if you can limit yourself to extended times indoor with people you don't know, that's the most important thing. If you're around people you don't know and you don't and not even necessarily that you don't know, if you have no confidence that they're being careful themselves. I mean, anybody can be. It doesn't take very long to get in a bad situation and get this virus and spread it all over the place. So that's what you have to think about. The trustworthiness of the people that you're around. So that's what it's coming down to. Talking about space, air number, the amount of space that you're in. Obviously, if you're outside, that's the best. If you're in a big supermarket, that's not too bad. If you're in somebody's house with a lot of people, that's not too great. So that's pretty much how that works. It is a volume kind of thing. Here's the number of cases, or hospitalizations, excuse me. We do see it goes up. This is on a 14-day rolling average. It's still trending up. Number of ICU COVID-19 patients is going up as well. And I think I imported that from another page, so I don't have that data directly. So let's go to that page. Good news on the hospital bed front. ICU bed usage is 81% as of the 13th. Excuse me. Regular bed usage is 73%. Both of these figures show a modest decline from the last week, so that is very good. So the number of beds is going down. Used beds is going down. So some of these people who are being admitted evidently aren't staying very long, or these. Yeah, I don't know what the criteria is for being considered admitted, but it may just be that I don't know. I'll have to look into that. As stated for the past couple of reports, the spike in COVID-19 hospitalizations is a record-keeping issue only, and it has to be because if we're looking at the total usage of hospital beds and it isn't going up, and the number of COVID-19 hospitalizations has supposedly gone up like 50%, well, something doesn't jive. Well, what doesn't jive is the reporting. One thing that should be noted is that it appears that North Carolina is pretty much maxed out the total number of available beds. And so I'm looking at the down here at this graph, this total number of available beds. So we've got the total staffed beds, and we've got total ICU beds. See, that line is flat, so that number has really not changed. That one, the inpatient beds, has kind of wavered back and forth, back and forth, back and forth, but now it seems to have hit its stride, and has been pretty stable ever since. Looks like about the 1st of July. So, but it does appear that that's about what we've got, and so I think that's probably a staffing issue. I think we do have a couple thousand more beds, but if you don't have people to staff it, they're no good, right? You just have somebody sleep in a bed, I guess, but that doesn't do any good. So that, there's the hard ceiling. I think that's what you would call it. COVID-19 cases now occupy, and I got this data off the other page. They occupy 613 out of approximately 2,400 ICU beds, which is up 100 from last week. Now, this could be part of the change in reporting, or it could indicate something more serious. And of course, that 100 in a week sounds serious, but then again, the utilization of ICU beds went down, and so I'm inclined to just think most of this is just a reporting issue. But that is something I'm going to keep a close eye on, because that's not very many beds that are available. It's like 474 beds are available right now. Outlook, the data is going to look the same as it has, but just continue to keep in mind that as long as the total utilization of ICU and regular bed stays around 80% or lower, there's no reason to be alarmed. And so, we're not anywhere near close to, like DEFCON 5 or anything like that, or Situation Red or whatever, somebody wants to tell you that, we're in deep trouble. We're not. Need to look beyond the figures, need to look beyond what the news tells you, and look at the stats. And of course, that's what this is for. So you can actually look at real numbers put out by the government. And so, I'm not, this is what it is. And I'm not playing games with the numbers either. That's what this is. These graphs are what they mean. I'm not doing any fancy functions or anything like that. I'm just saying, hey, look, here's what the numbers are, and I'm not playing games with it. So, hope that gives you some comfort. And no matter where you live, as I've said before, these numbers are for North Carolina. But if you live anywhere outside of the Northeast or the West Coast, excuse me. They pretty much apply. And so in a broad sense, and so demographically, like the South, certainly, like North Carolina, Tennessee, South Carolina, Georgia, Alabama, Mississippi, Louisiana, Arkansas, Missouri. Not sure about further out west you go, but all those, it's pretty representative, is what I'm trying to say. All right. I think that's going to do it for this week. If you have any questions or comments, leave them in the section below. Like and subscribe. We appreciate you do, and we'll see you. We appreciate it when you do, and we'll see you on the next Fact Filled video.